In this episode of the Nurse Practitioner Podcast, Navjot Kaur discusses telehealth. Has the use of telehealth changed how you practice?
It hasn't necessarily changed the way I practice. A great portion of the assessment or an evaluation of a patient is getting a comprehensive history. And that includes actively listening, engaging with patients, which allows us to be more present in the now, which I'd like to say. And I think that's all much more feasible with the use of telemedicine. Furthermore, there are some components of the physical examination that can actually be addressed via telemedicine. For instance, in what we call psych or behavioral health, you're able to observe a patient's affect. If we're specifically referring to a neurologic exam, you can observe for facial symmetry. You can observe someone's gait. So these are certain components of the neurologic exam. You can also assess their respiratory status. Are they having any difficulty breathing? Are they in a tripod position? This is especially pertinent given the COVID pandemic. We're also able to do skin exams. So for instance, I've had patients who come in with some sort of rash. We were able to see if it was, let's say, a contact dermatitis versus cellulitis. So these are some areas that we're able to view via telemedicine. One thing that I really appreciated with telemedicine is being able to assess the patient's living conditions, which can provide a unique lens into a patient's barriers to their health, or in other words, their social determinants of health. It's true that when patients are evaluated in the office, we're able to do more of a complete assessment with a comprehensive physical examination, point-of-care tests, labs, diagnostic tests such as EKGs, chest x-rays. But overall, the telemedicine during this time has benefited more than any of the risks associated with it.
What differences have you found in telehealth versus face-to-face interactions with your patients?
With in-person or face-to-face interaction, you're able to utilize all senses, such as your sense of olfaction, which can tell you about a patient's hygiene status and possible health issues relating to this. You can also pick up on one's energy or their aura, which can be helpful in determining how they're feeling at the moment. You can also use your sense of therapeutic touch. Therapeutic touch can potentially influence how individuals make decisions or what they would share with you next. Let's say, for instance, a patient is sharing their story regarding the death of a spouse or loved one, or anything emotionally challenging for them. You as a healthcare professional can offer a hand on the back for support, if seemingly appropriate based upon the provider-patient relationship and what the moment calls for, or simply give them tissues if needed. Touch is also utilized as part of the physical examination. So let's say you are palpating one's pulses, or you're, again, palpating their chest for any heaves or whatnot. It's utilized in that regard. You're able to utilize your sense of hearing as well. Not only are you actively listening to the patient, but now you have the added benefit of auscultating their lungs, hearts, or abdomen based upon their chief complaint. In-person interaction allows us to get a more accurate assessment based not only on the patient's history, but their physical examination and associated labs and tests. On a positive note, in my experience, I have noticed that the face-to-face interaction using telemedicine has boosted patients' engagement in their own healthcare, especially with new patients who have not yet established care with a provider.
What challenges have you encountered?
As with most things in life, there are some challenges with telemedicine. I have categorized them into 3 distinct categories for simplicity purposes. Number 1, there can be technical issues. Number 2, there can be financial issues. And number 3, there can be issues regarding what I call the appropriateness of the patient. In regards to technical issues, some patients don't have access to a smartphone or a laptop to utilize this service or even internet service. Other times, there may be an interruption in Wi-Fi connection, which is usually amendable by reconnecting to telemedicine or completing the rest of the assessment on the phone which I've done in a few cases. Some patients, particularly the elderly, may not know how to utilize smartphone technology or can present with a sensory deficit, such as a patient who is visually impaired or hard of hearing, which can limit the use of telemedicine. Furthermore, non-English speakers or patients who speak very limited English may not benefit from telemedicine at this time unless the practitioner conveniently speaks the same language as the patient, or we add on a language interpreting service like the MARDI, which helps translate languages, and we use this in the office. This, in turn, increases access to care, especially with minority groups who continue to face a plethora of barriers in accessing safe, quality, and cost-effective healthcare. As we ramp up our in-office appointments, we face yet another rather small technical challenge. That is, balancing our in-office visits with those scheduled for telemedicine. This can create transient anxiety when rushing from one in-person visit to the next visit, which is a telemedicine visit. One way NYU has overcome this is by integrating a wait option, which, when clicked by the provider, notifies the patient that the healthcare professional is running late, let's say about 5 or 10 minutes, and the patient can check in at that time, which again can help alleviate some anxiety. Another way to tackle this is by changing one's scheduling template, perhaps scheduling only telemedicine visits in the afternoon, as an example. In regards to financial issues, we must acknowledge that not all insurers cover telemedicine, but this is constantly evolving. In general, practices are not generating as much revenue as they would for in-person visits. In regards to the appropriateness of a patient, there are limits to which patients you can actually see via telemedicine. Some acute conditions need an in-office evaluation. For instance, if a patient presents with ear congestion or pain, we are limited to components of the HENOT, or head, eyes, ears, nose, oral, throat physical examination, including the use of an otoscope. Again, some differentials for ear congestion or pain include, let's say, possible cerumen impaction, serous otitis media with effusion, which is viral, both of which do not require antibiotics. Or the patient can indeed have a bacterial infection, or let's say a ruptured TM. Due to the limited nature of the exam, practitioners may fall into the trap of overprescribing antibiotics, when indeed monitor or the wait and watch approach may be more appropriate. Another example is of an individual who presents with chest pain. Surely with the use of telemedicine, we can get a focused history and assess a patient's cardiac risk factors to assess for possible cardiac disease. But it is more helpful to have the patient on site. That way we can perform a physical examination, including assessing a patient's respiratory efforts, auscultating a patient's cardiac and respiratory sounds, palpating pulses, and obtaining diagnostic tests such as an EKG and chest x-ray during that visit. Earlier, with the stay-at-home order surrounding the COVID pandemic, I had a couple of patients via telemedicine of whom I was concerned about possible myocarditis or pericarditis, and had suggested a nearby urgent care clinic to obtain an EKG at very minimal to assess for possible differential diagnoses. And the point here is there are a number of patients that would benefit more from an in-person examination than only a telemedicine consult.
Are there distinct benefits to using telehealth?
There are certainly a number of benefits when you utilize telemedicine. First and foremost, given our pandemic, telemedicine provides an opportunity to provide ongoing care for chronic issues such as hypertension, diabetes, obesity, coronary artery disease, asthma, which is really important because most of the time these patients have quarterly visits or let's say every 6 months they come in to assess their blood sugars or blood pressure. And most of these patients already have the devices at home, and they can report their readings to us, and we could make some medication adjustments based upon what they say to us. Now, as I was referring earlier, because of the COVID pandemic, we are actually seeing a number of patients and providing a safety outlet for them. So they're not necessarily exposed to COVID, as an example. So we're really slowing the spread of infection. So other benefits of telemedicine include it offers counseling services, as I mentioned earlier, for weight loss, smoking cessation. There's also benefits when it comes to psych mental health, which is really more pertinent to our psych behavioral health providers as they do perform more therapy. It also allows for other medication adjustments such as birth control, antidepressants, stimulants, which has really become more efficient and effective for patients to communicate with us via telemedicine as opposed to coming in every 3 months to refill their medications. It also allows providers to truly follow up on their visits. So what I mean by that is generally when we see patients, we have a number of lab results, diagnostic tests, screenings, including colonoscopies, mammograms, imaging results. And it's so important that we take our time to follow up and clearly communicate the diagnoses as well as discuss next steps when it comes to such tests. And this also allows us to continue to be revenue generating as opposed to a phone call, which is typically not as feasible for a provider with a busy practice, as an example. And it's not really billable to just call a patient on a phone as opposed to doing a telemedicine visit. It also provides access to some minor urgent healthcare issues, such as URIs, which are upper respiratory infections, let's say sinus infections, or sore throats. Now, to be clear, there's a pro and con in this. While we can generally reserve and say, let's monitor some symptoms when it comes to a viral infection, some may say we may start overprescribing antibiotics. So if a patient comes in and says, you know what, I can't, if it's really painful when I talk, I have a fever, some providers may empirically treat with antibiotics. So that in itself may be a challenge because now we're overprescribing antibiotics, killing the gut flora. Also, we're growing in terms of resistance to antibiotics. So that's certainly a catch-22 when it comes to that. Other things that we can address via telemedicine. It's really interesting because people typically avoid healthcare, and telemedicine is one of the great ways for them to access convenient healthcare and allows them to be more engaged. For instance, healthcare professionals like myself are one of the groups that neglect their own self-care needs, including annual physicals, general screenings, and whatnot. Most of the healthcare professionals I've evaluated were initially scheduled their appointment because they needed a COVID PCR test or the COVID antibody test as a means of returning back to work. Or let's say they had symptoms of COVID, again, keeping them out of the office so we don't infect other people around them. Again, a safety barrier which telemedicine provided. But most of them, this became an opportunity to address other chronic care issues. So by the end of the telemedicine appointment, after I scheduled them for a COVID PCR test, as an example, I'd say something as simple as, let's schedule an annual physical once you're feeling better so we can discuss other issues such as anxiety, high blood pressure, whatever the issue is, or just doing a general screening. And most patients till date have scheduled their annual physicals, and it's been perfect. It's actually been a game changer for some of my patients.
How have patients reacted to visits via phone and or video?
Great question. Yeah, overall, we've really gotten a positive reaction. And again, the number one thing we've been seeing is there's less exposure to illness and infections, specifically surrounding the COVID pandemic. People feel more safe, right? Because we're speaking via a FaceTime screen, and they're able to communicate as well as they'd like without having to be exposed to anyone near them coughing or any signs of anything that would be infectious to them. So again, overall, a very positive reaction. People feel listened to, which sometimes, again, when you're in a busy practice, working outpatient or even inpatient, sometimes it's truly challenging to give patients that adequate time to listen to their concerns. And I always say active listening is key when it comes to patients, because that really guides how we can address their issues going forward and really optimize their health.
Do you think the use of telehealth technology will continue to expand even after we're back to a somewhat normal environment?
Sure. I think telemedicine will serve as an adjunct to mainstay medicine. And the reason why I say that is because in primary care, as an example, I would say telemedicine would still serve as 20% of our visits. And the main reason behind that is in primary care, we're typically doing annual physicals, which require in-office visit, right? Because we're doing labs, we're doing a physical assessment, and so on. And for chronic care issues, eventually they'll need to come into the office for us to better evaluate them. So by that token, I would say for primary care providers, it'd be about 20%. However, this is really specialty dependent. Now, let's take psych behavioral health providers. For them, telemedicine may be 90% of their patient population going forward. And that's because they can provide opportunities in terms of listening, giving therapy, medication management. That may work really well for them. This may also work very well for post-op visits. So let's say a patient had a knee replacement and we're observing the site for any infection. That may be a perfect idea to engage in telemedicine as opposed to physically coming in when they'll be limited secondary to knee pain post-op. So those are some considerations in terms of telemedicine moving forward. So there's definitely a role of telemedicine continuing to be part of mainstream medicine.
This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed in this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer.